everyone. So now we are going to look at the disease that is pericardial disease. It is inflammation of the pericardium, pericarditis, and there are different causes of pericarditis. Like first one is it can be occur because of alcohol intoxication. It can be because of beriberi or viral disease like Coxsackie virus can cause pericarditis or pericardial diseases. Dressler syndrome and rheumatoid disease can also be contributing factor for pericardial diseases. What clinical findings can we find? Patient will have shortness of breath, there will be pericardial rub, and in constructive pericarditis there will be compression of heart which will present with the beak striate. And then laboratory investigations will have patient will have ST elevation in ECG. On echo there will be viral disease history. Viral illness like Coxsackie virus is causative factor, so it can lead to pericardial diseases. And its chest CT can also help in diagnosis for pericardial diseases. What can be the treatment for pericardial disease? That is, treat the underlying disease like systemic lupus erythematosus. If patient has any rheumatoid disease or SLE, then one has to treat that. Or NSAID can also be beneficial in pericardial diseases. So this one is the clinical findings and clinical vignette for pericardial diseases. That patient will have alcohol, beriberi, Coxsackie virus, Dressler syndrome, and rheumatoid disease. And the mnemonic for pericardial disease is A, B, C, D, R. Alcohol, beriberi, Coxsackie virus, Dressler syndrome, or rheumatoid diseases like SLE can cause pericardial diseases. So these are the most important points for pericardial disease. You can look at the findings and one can solve questions related to pericardial disease.